So today the topic for discussion is hemorrhage and its management. So coming on to its definition of hemorrhage, it is a prolonged uncontrollable bleeding. We can term it as hemorrhage. The source of bleeding, it can be arterial, which will be rapid, profuse, pulsating and bright red in color. The venous bleeding will be steady inflow, non-pulsating and will be dark red in color, and capillary bleeding will be slow and oozing. Clot will be formed spontaneously and less red than arterial bleeding. Coming on to its classification, the types are according to the sources. What we have discussed are arterial, capillary and venous type of hemorrhage. According to the time of onset, you can term it as primary hemorrhage, reactionary hemorrhage and secondary hemorrhage. And under primary hemorrhage, which will be occurring at the time of injury, for example, when we do an extraction, immediately you can see a bleeding. That will be capillary hemorrhage and we can term it under primary hemorrhage. And if the bleeding occurring after 8 to 24 hours after an extraction, we can term it as a reactionary or intermediate hemorrhage, which can be caused due to loose foreign body, broken bone pieces, pre-exist granulation tissue. And under secondary hemorrhage, which will be occurring after 24 hours to several days, cause can be due to dislodgement of clot, secondary trauma to wound, infection or elevation of any blood pressure. Coming on to its clinical classification, there is revealed type of hemorrhage, which can be visible external hemorrhage, and concealed type of hemorrhage. Example can be internal hemorrhage such as liver injury, hemorrhage caused due to spleen injury and hemothorax. There are an injury which is initially concealed but later revealed, for example hematuria. Based on its duration, we can classify as acute hemorrhage, which is occurring sudden severely after the trauma or surgery. Chronic hemorrhage, repeated bleeding for a long time, for example peptic ulcer bleeding, hemorrhoids. And acute and chronic hemorrhage, which is more dangerous, which is occur in hypoxic individuals. Based on possible intervention, we can classify it as surgical hemorrhage, which can be corrected by surgical intervention only, and non-surgical hemorrhage when there is a diffuse ooze due to any bleeding related disorders like coagulation abnormality or disseminated intravascular coagulation, that kind of diseases. Coming on to its major classification of hemorrhage, we can classify it as class 1 when there is a bleeding of or blood loss of 750 ml or less than that. There will be normal heart rate, ventilatory rate will be normal, the systolic blood pressure will be normal. And in class 2 conditions, when there is a blood loss of 750 to 1500 ml, the heart rate will be slightly started increasing, and the ventilatory rate with that also will be started increasing from 20 to 30 breaths per minute. Systolic blood pressure will be normal and urine output will be started decreasing. And these class 1 and class 2 can be compensated with crystalloid solutions such as DNS, NS or ringer lactate solutions. And in class 3 situation, when there is a blood loss of 1500 to 2000 ml, the heart rate will be started increasing more than or equal to 120 beats per minute. Ventilatory rate will be 30 to 40 breaths per minute, and systolic blood pressure will be started decreasing. And there won't be any crystalloid transfusion is needed. At this condition, we have to transfuse the whole blood solution, or blood transfusion should be done, or fresh frozen plasma should be transmitted. And in class 4 situation, when there is a blood loss of 2000 ml or more, the heart rate will be more than equal to 140 beats per minute. Ventilatory rate will be more than equal to 35 breaths per minute, and the systolic blood pressure will be greatly started decreasing, and urine output will be minimum. And this is a fatal condition. This can lead to death. Coming on to its pathophysiology of blood loss, when there is a blood loss, there will be hypovolemia will be happening. As we discussed, there will be lowering of cardiac output, decreased oxygen demand to the tissues, which can lead to shock. This situation will lead to aerobic metabolism and production of lactic acid within the muscles, which can lead to organ failure and death. And here are different hemorrhagic diseases such as hemophilia, Christmas disease, factor 5 deficiency, factor 7 deficiency and all. Coming on to the clinical features, when there is a huge loss of blood, the patient will be having pallor, cyanosis, thirst, air hunger can be seen, dry face and mouth, thready pulse, hypotension and oliguria can be seen. Signs of significant blood loss: when there is an increased blood loss, there will be increase in heart rate, increase in diastolic, increase in ventilatory rate, decreasing in systolic and diastolic BP, which and shock index with further will be more than 1. The complication, if not treated properly, can lead to organ failure, seizures, coma and death. So coming on to the hemostasis, whenever a bleeding happens, a coagulation should be formed or coagulation factor should be acted upon. So hemostasis is defined as an arrest or stoppage of bleeding, and this is based on the coagulation system which we'll be discussing, and it will be happening in 3 stages. Initially, when there is an injury within the blood vessels, a vasoconstriction will be happening. With that, a platelet plaque formation and coagulation of blood will be happening. And this is the cascade of how, when there is an injury to the blood vessel, when there is a damage, there will be exposure of collagen. With that, platelet aggregation and platelet plaque formation, which will lead to blood clot formation. And coagulation of blood is happening in 3 stages and 2 pathways, which includes 13 coagulation factors. The 2 pathways, which is intrinsic pathway and extrinsic pathway, these are the blood clotting cascade. And in intrinsic pathway, in which the endothelial damage and collagen exposure will lead to platelet plaque formation, with the help of blood clotting factors such as factor 12, 11, 9 and 10, the prothrombin activation is happening. Prothrombin will get activated into thrombin, which is happening in stage 2, and in stage 3, the fibrinogen with the help of blood clotting factor 13 and calcium will result in fibrin tight blood clot formation. And these are the different stages which we have discussed. So coming on to the diagnosis of bleeding or hemorrhage, we have to have a proper case history. First of all, we have to have a proper case history of, in case of any type of bleeding happen with the patient, and clinical examination should be done properly, blood investigation should be done, and commonly blood investigations are platelet count, bleeding time, prothrombin time and international normalized ratio, and these are the normal values of the blood investigations. And there are some drugs which interfere with the blood clot formation. So that type of drugs, some kind of aspirins, antiplatelet drugs which the patient will be taking due to any related cardiac disease, or anticoagulants, or antibiotics, anti-cancer or alcohol. That these all can, there are some kind of drugs which can lead to the stoppage, prevent the stoppage of bleeding. An oral manifestation in individuals with bleeding disorders, there is petechiae, gingival hyperplasia, ulceration of oral mucosa and lymphadenopathy. And coming on to the hemostatic methods, whenever an hemorrhage or bleeding happens, a coagulation should be formed to prevent the individual further from the bleeding and death. So there is a set of local hemostatic methods and systemic hemostatic methods. And under local hemostatic method, there is mechanical, chemical and thermal methods. Under mechanical methods, we can use a pressure pack using a cotton or gauze, can use sutures using silk material or absorbable materials, ligature can be used, embolism can be formed, and hemostat and staples also can be used. Under thermal methods, most commonly used are electrocautery, with that laser can be used and cryosurgery also can be used. And under chemical materials or methods, we can use astringent, adrenaline. In case of an bleeding from extraction socket, immediately the local anesthesia will be having adrenaline content, so we can dip the gauze pack and place it in the extraction socket to prevent the bleeding. Thrombin also can be used, and fibrin glue also can be used to seal the extraction socket or an open wound. and gel form, bone wax also can be used. Coming on to systemic agents, we can use vitamin K injection, fibrinogen, ethamsilate, platelet-rich plasma, fresh frozen plasma, and these all are given in case of increased blood loss more than 1500 ml. And blood substitute, when there is an severe injury and trauma and huge blood loss, the patient is profusely bleeding, we can transfuse the HES, hydroxyethyl starch or hemosil or gelatin. So the viscosity of the blood will be more, so it prevents the escape of blood through the blood vessels. Now, artificial blood, that is the reason advances perfluorocarbons, trauma-free hemoglobin can be used. And these are some other drugs and hemostatic which is commonly used. And in case the patient is having bleeding more than 1500 to 2000 ml of blood loss, as we discussed, we have to go for a transfusion. So in that case, we have to collect the blood of same typing and grouping to be done prior, and we have to collect the blood of fresh frozen plasma or fresh whole blood or platelet content or freeze dried animal anti-hemophilic globulin and freeze dried human. So these all to be given only in case of more than 1500 ml or 2000 ml of blood loss after checking the blood grouping and blood typing. Thank you.